Hello, everyone. Thanks for joining us. We're just waiting for a few more people to join. I know sometimes computers can be a little bit slow, so we'll give it another 10 or 15 seconds. And I thank you in advance for holding. Hello, everyone. Thanks for joining us today. We're just waiting for a few more minutes for some people to join. I know sometimes it can take a few seconds for your computer to connect. So thank you in advance for holding. Good afternoon, everyone, and thank you for joining us today. We have a few housekeeping items before we start today's program. I'm Andrea Jensen. I'm an education specialist for Allergy and Asthma Network, and I'm also a certified asthma educator. All participants will be on mute for today's webinar. We will record the webinar and post it on our website within a few days. You can find all of our recorded webinars on our website at allergyasthmanetwork.org. Scroll to the bottom of the page to find our recorded webinars and any upcoming webinars. The webinar will be about 1 hour and we'll leave time for questions. We'll take those questions at the end of the webinar, but you can put your questions in the Q&A tab at any time. The Q&A box is at the bottom of your screen, a little bit on the left side there. We have someone monitoring the chat if you have any questions or need any help. We will get to as many questions as we can before we conclude today's webinar. We do not offer CEUs for this particular webinar. However, you will get a certificate of attendance. A few days after the webinar, you will receive an email from Zoom, and it will have resources from the webinar and a link to the certificate of attendance. We will now begin today's webinar. Asthma can be managed by using medication, but it's also very important that the living environment is allergy and asthma friendly. This webinar will help you learn how to make your house or apartment allergy and asthma friendly. Allergy and Asthma Networks is a grassroots organization that was started over 35 years ago by a mom who knew that other mothers like her needed resources and support. Our mission is to end the needless death and suffering due to allergies, asthma, and related conditions through outreach, education, advocacy, and research. Today it's my pleasure to introduce our speakers. Dr. Sharmilee, pardon my speech. I have long COVID and I'm a little bit on slow today. Dr. Sharmilee Nyenhuis is an associate professor in the Department of Pediatrics and Medicine. She is associate chair of diversity, equity, inclusion in the Department of Pediatrics at the University of Chicago. She is also an allergist, immunologist, and implementation scientist committed to addressing disparities in unique and minority populations with asthma and allergic diseases. Her research portfolio aims to examine the association of real-time indoor and outdoor air quality and asthma outcomes, test and implement interventions that address diet, weight loss, and physical activity in minoritized asthma populations, and examine the impact of climate change in medically underserved populations. Her overall goals are to expand the knowledge of lifestyle behavior change in asthma to improve the lives of minoritized populations with asthma and to refine best practices for implementation of lifestyle interventions. Dameka Edwards-Hart is a proud Chicago South Sider that was born and raised in Englewood. She serves as a supervisor of community health workers and special programs for the Liaisons in Care, the LINK program, under the University of Chicago Medicine's Urban Health Initiative, UHI. Dameka joined the UHI team in 2017 as a community health worker, where she has a proven record of accomplishment in helping pediatric patients and their families overcome health disparities relating to asthma. Dameka is a true veteran in the public health field and began her career as a community health worker 8 years ago with the University of Illinois in Chicago. During that time, she received extensive asthma and community health worker core skill training with the Sinai Urban Health Institute. Through this training, she has gained the necessary knowledge needed to make her a well-rounded health educator. The role of a community health worker is more than just a job for Dameka. She has made it one of her life's missions to not only help UCM's patient population to overcome inequalities and social determinants of health, but she has also set a goal to prove how important this role is by recruiting, assisting, and training those entering this field behind her. So excited to hear this important information from both of you today because we know that a healthy environment is so important to asthma control. So you may now begin your slides. Thank you.
Great, thank you, Andrea and the Allergy and Asthma Network for inviting us to speak today. This is, as Andrea said, this is such an important topic. So you may realize and know that allergies and asthma impact a large number of our population. So it can strike 1 out of 5 Americans, and over 60 million people are impacted by allergies and asthma. This slide shows that this is much higher than some of the other diseases that get a lot of attention, such as diabetes, as well as coronary heart disease and cancer. So pretty much all of these added together would give you, the 60 million people that are impacted by asthma and allergies. Now, why is this important is because about over half of asthma is allergic asthma, and in particular in school-age children, more than 80% of asthma that we see, the children are sensitized to at least one common environmental allergen. Also, many people ask me, can you develop asthma allergies at any age? And that is true. So it's not something that you always get when you're younger and sticks with you for life. You can develop them at any age. We also know that allergies is a risk factor for developing asthma. So if you have allergies as a child, you are at a much higher risk of developing asthma than those people that don't have allergies. Also, allergies are associated with an increase in asthma symptoms as well as asthma severity. And it is well known that allergies can be a trigger for asthma flares. And with this, the national guidelines recognize the importance of managing allergies in people with asthma. So what is an allergen itself? So an allergen is any substance that can cause the immune system to overreact, and often also known as an allergic trigger. So this could be a whole host of different allergens, and an allergen for one person doesn't mean that that's going to be an allergen for other person. But some examples include pollens like grass pollen, tree pollen, weed pollen, but also can include medications as well as foods shown here, and other things like poison ivy and others. So these are just some examples. So how do these allergens cause disease, or specifically, allergies and asthma, or contribute to asthma? Is these allergens can be inhaled, and that ends up going into the airway that can lead to inflammation. So here's just a little bit more of a diagram showing that, the allergens are often become aerosolized or become so small that we can inhale them. And when we inhale or breathe them, this is known as an inhalant allergy. And as shown here, pollen is an example of an inhalant allergy, also mold, and we'll discuss some other ones. So once these individuals, or once people breathe these allergens into their airways, then this can lead to inflammation of the airway and obstruction of the airway, or blockage of the airway. And this occurs really only when the airways are sensitized or very sensitive to those allergens, and that can be through an allergic response, but it also can be due to an irritant response. If somebody doesn't have any, if they're insensitive to these allergens, either not allergic or again, not impacted, doesn't cause an irritant reaction, then you won't see any inflammation or obstruction of the airways. So some of the different types of inhalant allergens, and today we're going to mainly focus on the indoor inhalant allergens. These can include animals, and so we'll start there first. And these are the furry animals that we love to have in our home, and are part of our families sometimes. And these can be cats, dogs, but can also be rabbits, guinea pigs, hamsters. And the allergens from cats and dogs typically come from their fur or their skin, which is often known as their dander, and also can be, in some, to a lesser extent, the saliva of these animals. So these particles that carry cat and dog allergens can be small, and then these can become airborne or go into the air with little disturbance and can remain airborne for many hours. So the main allergens from cat and dog, first of all, for cat, it's called FeLD1, and for dog are CAN-F1. These are produced by the animals, and it's very difficult to say that they're not produced unless they're genetically modified. So, some people say, oh, there are, an allergen-free dog or allergen-free cat. Unless typically it's been genetically modified, they all are going to produce some amounts of these different proteins that I mentioned, which can be these major allergens. Now, some animals can produce more and some can produce less. So that's why some people, I think, can tolerate certain types of animals, whereas other people can't tolerate others. So what's important feature of the particles that carry that dog and cat allergens is that they can be easily transferred on clothing from homes with pets to homes and other buildings without pets. So we've seen that both cat and dog allergen is very ubiquitous or in public buildings or even schools because of this passive transfer that happens. So, in one of the national allergy studies, cat and dog allergens were detected in virtually all homes and levels that were considered to be high. And that was found in almost half of the homes. They found high levels. While only cat and dog allergen is detectable in homes without pets, allergen concentrations are typically much higher in homes that have pets. So again, homes that have pets have much higher levels than homes without, but we do see pet allergen levels in homes even that don't have pets, because again, these proteins, the allergens or proteins from the cat and dog travel both on large and small particles and can very easily be transferred. So some of the other indoor inhalant allergens, we think of these maybe as the more less desirable in the home, and these could be pests such as mice and cockroaches. Now, mouse allergens primarily come from mouse urine, but could also come from dander. And cockroach allergen actually mostly comes from their fecal pellets or dried carcasses. Although mouse and cockroach allergens are found everywhere, both rural, suburban, urban areas, we definitely see levels tend to be higher in urban environments. And this slide just demonstrates that where they looked at different concentrations of cockroach allergens in different housing, in different dwellings. And here the reference value is a detached dwelling, so meaning kind of like a single family home. And they found that compared to detached single family homes, a high-rise apartment is 70 times more likely to have high levels of cockroach allergen. And this was also found in row houses, duplexes, triplexes, and low-rise apartments. So compared to, again, a single family home, those types of dwellings are more likely or have a much higher odds of having cockroach allergen. And one thing I often tell my patients is that, you may be keeping a very clean home yourself, but you don't know what the other neighbors are doing, which could potentially be attracting these pests into the building itself. Additionally, it was found that the number of units in the building was correlated with higher levels. So the more units that were in a building, the more likely there was to be higher cockroach allergen levels. Further, when the house was built has an impact. So definitely if the home was built before 1940, that appears also to be a risk factor for high cockroach allergens. And then further too, as I mentioned earlier, urban population. So if the population, where someone's living is greater than 1 million, there was 3 times more likely to have high cockroach allergen. So I always find this very interesting that it's very dependent on multiple different factors regarding the home. So another type of indoor inhalant allergen is mold, and mold can grow both in outdoor environments as well as indoor environments. So it's important to know that it's not just an indoor thing or outdoor thing. Molds can be found in all regions and climates of the United States, and levels of outdoor mold can vary by season and in some geographic regions. Living here in Chicago, I often tell people, molds can be present from the first thaw, usually until the first frost. That's for the outdoor ones. But again, if there is mold in the home, that could impact people all year round. So I also wanted to point out that in addition to these allergens, there are definitely irritants that can be found in the home. And these can include firsthand and secondhand and even thirdhand smoke. Also other smoke from fires, campfires, barbecue pits. Also pollution and ozone can also be an irritant or trigger for asthma. And then those things that we use in our house a lot and maybe don't necessarily think of triggers, but can be things with strong smells or sprays. So candles, incense, air fresheners, but then also even thinking about cleaning supplies, such as detergents or other disinfectants. All of those can also be a trigger. Again, these typically aren't considered allergens, and these can't be tested to. We can't do allergy testing to these things, but this is something that commonly we see in the home and can be a trigger for asthma symptoms and exacerbations. So how do we evaluate the inhalant allergens? So there are definitely in the national guidelines, there's information on who should be evaluated. And essentially, they indicate that all patients that have asthma should be asked, first of all, about exposures to the inhaled allergens, especially indoor allergens. So again, these can be mice and cockroaches and molds and dust and pets. And again, they indicate that everyone should be asked about it. And this is really high quality evidence. So who really should be evaluated? In the recommendations, they say that it should apply to anyone that has persistent asthma, meaning that they're taking a daily medication for asthma or having symptoms 2 or more times per week or nighttime symptoms 2 or more times per month. But it's also worth recognizing that in the guidelines, they say that for at least those patients who have persistent asthma. So this really this indicates that these recommendations could also apply for individuals with what we call intermittent asthma as well. So typically, we will use the patient's history to help guide us and determine what potential allergen exposures may be worsening their asthma, but it's really essential to also use testing. So there are 2 different kinds of testing. There's allergy skin testing, which typically you have to go to an allergist or ENT doctor to have done, or there is also allergy blood testing, which that can be done by a primary care doctor, a pulmonologist, an allergist as well. And those can be used to help reliably determine what somebody is allergic to and to which and help guide management. Now, it's really, again, important. There have been studies showing that using the medical history alone is not good enough. And again, it really requires the testing. So I really caution people to, ask somebody, oh, do you have a cat or dog? And then go say, yeah, you should remove the cat and dog from the home without doing testing. So again, when doing the allergen testing, there are multiple factors we have to consider. So we always consider, first of all, what geographic area are you living in? Because there are, in different parts of the country, there's different kinds of tree pollen, grass pollen, weed pollen. So it's just really important that the testing is potentially done based on the geographic region. So here in Chicago, we aren't testing to pollens that are present in Florida or in California. We're testing to what is here primarily in the Midwest area. Another consideration is where the individual lives. So are they living in an urban, suburban, or rural setting? Because as I mentioned earlier, mouse and cockroach allergens are often found can be found in all of those settings, but they're much higher in urban settings. So again, doing testing to mouse and cockroach might be especially important in more urban settings. There's also other individual circumstances. So considering, again, what pets somebody has. So if somebody has a pet rabbit or guinea pig and they're concerned that might be triggering their symptoms, then it's reasonable to include those testing, but that's maybe not something that I would do for everyone. And then finally, also considering work exposures. So you may want to, if somebody works in a lab with rats or other animals that we typically wouldn't test for, but is having more symptoms again, potentially at their workplace, it's definitely reasonable to include and consider doing testing for those specific allergens. So how do we control some of these inhalant allergens? And again, I typically tell my patients that the first 3 things that we do in allergy once we find out somebody's allergic to something is avoidance, avoidance, and avoidance. So we really try to avoid it, but it can be difficult in many cases. So one of focusing on the national asthma guideline recommendations, and this is based on some of the new updates from 2020 is that, again, in patients who have asthma at any level severity, so whether it be intermittent, mild, moderate, severe, we should definitely be reducing exposure to the allergens that somebody is allergic to and exposed to. Now, they do specifically recommend though, that in people that don't have allergies, so if you evaluate them, they are not allergic to anything, then we don't, the recommendation is not to remove the cat or dog or reduce dust exposure. So that wouldn't necessarily be part of the routine asthma management, again, if they're not allergic, or if they don't have symptoms related to that exposure. So that's something to consider. And then here are some of the other highlights of the NAEPP recommendations regarding some of the specific sources of inhalant allergens. And at this time, I'm just going to go ahead and have Dameka talk a little bit about this because of her expertise in this area on making recommendations on how to manage exposures to reducing exposures to different allergens. I'm sorry.
Thank you, Dr. Nyenhuis. So, of course, when we think about pets, oftentimes they are considered a part of the family. So it is very hard to just expect someone to just get rid of their animal. But there are ways that we can, possibly keep someone that has asthma and that are allergic to the animal around while, trying to keep them safe also. So some of the things that we like to recommend to patients is keep the pet out of the bedroom. So we know that kiddos love their animals too, but it's not safe to have the animal in the area in which the child sleeps because we don't want them breathing in that pet dander. So again, that is, the fur that they shed and the saliva and things like that. So it's very important to make sure that the pet is kept away from the child's sleep, the patient's sleeping area. Another thing we recommend is to keep the pet off of the furniture. And we also recommend using a HEPA filter vacuum cleaner, if possible, to kind of clean off the fur if the animal is one that is used to jumping on the furniture, and also washing the pet frequently. So even if that includes taking them to the groomers often, or even washing them at home. And another thing that we recommend is that you always wash your hands after you touch the pet. That way, if there's that excess fur, fur that's on your hands, you're not rubbing it across your face or putting it on your body when you're done playing with the pet. Next slide, please. So this kind of just backs up what I was saying. So we recommend all homes have, if possible, a HEPA filter, and that we are reducing the amount of time that we are spending with the animals, especially when it comes to that close contact. So, of course, we don't want to keep the pet sheltered in a spot like a cage or whatever. But if there is a room that the person with the allergies don't often frequent, if we can have the pet in that area when the person that is allergic is around. Next slide. And this slide is just talking about ways to reduce the exposure to pests. So no one likes to have pests. And of course, as mentioned earlier, sometimes when you're living in close proximity to your neighbors, specifically apartments, the chances of, no matter how clean you keep your spot, the chances that if your neighbor has these pests, they may come over to your apartment too. So some of the things that we can do to kind of remediate the exposure is making sure that we are keeping all food in closed containers, or packed away in a refrigerator and things like that, making sure that we are minimizing things that are wet. So for example, like if there's a wet rag that you may have in your, excuse me, in your kitchen, making sure that we put that away or make sure that it's completely dry with, as opposed to just leaving it out while it's wet. Making sure that we are sealing any cracks or holes that we observe. And we know that this can be tricky sometimes when it comes to renters. So you can absolutely talk to your landlord in this regard to assist in sealing some of those cracks and holes. And of course, you can always reach out to your physician if you need assistance with like getting a letter drafted or anything like that. So of course there are pesticides, but we are not really, that's not really at the top of our list to recommend, because we know that a lot of them contain a lot of toxins. So if possible, if that's the route that, you need to take, of course, if you need to outsource to a pest control company, making sure that they are using more green products to reduce the amount of toxins that they will, spread in your home. We can always make sure that you are cleaning up any spills and try to eat in one location. The reason why this is important is because if you can possibly contain them into one area, they're more easy to control as opposed to different parts of your home or your apartment. And also making sure that you are taking out your trash frequently. And it's very important to, if possible, have a trash can that has a lid on it that closes tightly so that those pests aren't climbing into your garbage can. And so the bottom says, individuals with asthma who have a sensitization or symptom related to exposure to pests, the expert panel conditionally recommends the use of integrated pest management alone or as part of a multi-component allergen-specific mitigation intervention. Next slide, please.
I think this we wanted to show again that that first of all, that mouse allergen is widespread, both can be in the workplace as well as the home settings, and again occur primarily we do see higher levels in urban areas as well as multifamily dwellings. And there is research to show that exposure to these allergens, specifically mouse and rat, has been associated with worse outcomes in those children that are allergic to it. And definitely the mitigation incorporates all the things that Dameka mentioned on the last slide, and definitely reductions in mouse allergen can also improve asthma symptoms. So now Dameka will talk a little bit more about management of house dust mites in the home.
So yeah, so dust mites is something that we all encounter. And there are things that we can do to kind of reduce the amount of dust mites that are in our home. So for example, it's always recommended to use like a mattress cover or a pillowcase. We want to make sure that we are covering those. We want to create like a barrier between our actual skin and the actual pillow or the mattress. Also making sure that we are washing our bedding frequently. So, and of course, with everything, medicine and research is always updated, which is a good thing. So it used to be once upon a time that it was recommended that you have the highest amount of heat possible when it comes to the water in your washing machine when washing your bedding to eliminate the amount of dust mites. But research now supports that it doesn't matter because you are killing the dust mites by drowning them, which is a good thing. So, but we want to make sure that this is a weekly practice because believe it or not, over time, over a certain amount of years, dust mites can make your mattress weigh twice its size if we are not, cleaning the bedding off and it just allowing, the dust to just collect up in our sleeping area. Okay, so again, so this is the first line remediation that you want to take. So make sure that we are using mattress and pillow covers. Make sure that we are washing bedding often, and washing the stuffed animals if possible, or even removing them altogether. Another thing is to make sure that we are controlling the humidity, because of course, the more humid it is in your sleeping area or in your home, the higher the chances are for more dust mites. Making sure that we are removing carpet or using a HEPA filter vacuum cleaner to vacuum very often. And same with cleaning like your upholsteries, your furniture, the casings on your furniture, as well as your curtains. And you want to make sure that there are filters like in your ventilation system, and make sure that you change that often too.
Great. Now, just wanted to highlight, as far as in the new guidelines, they did talk about the management of house dust mites, and particularly they indicated that it isn't just enough just to do the mattress and pillow coverings. That itself has not shown to have an impact, but if it's part of again, multi-pronged approach with a lot of the things that Dameka just mentioned, then it is recommended. So we've gone through pets and pests and dust mites. So now we will talk a little bit about how to manage indoor molds itself. Now with indoor molds, we know that, again, similar to the dust mites, they thrive in very humid environments. And so the guidelines do recommend that individuals with asthma who are sensitive to indoor mold should take measures to really decrease that indoor humidity to less than 50%. So this could include ventilating bathrooms and kitchens. So turning that fan on when you're in taking a bath or a shower. Also making sure that we're repairing leaky faucets, because that can also contribute to the humidity, and as well as it can contribute to mold accumulation. Also, you would definitely want to address any water condensation problems. So if you're seeing any areas where there's a lot of water buildup, especially often seen again in the bathrooms and kitchens, but could occur in bedrooms, you want to make sure that that is addressed. Also, some people think about utilize humidifiers and vaporizers to help increase the indoor humidity, but you have to be a little bit careful with that, because sometimes there's filters in there, or even if they don't have filters, the humidifiers and vaporizers itself can be contaminated with mold, and then you're just putting mold into your air. So typically, often we do not recommend the use of those things in the homes of patients with asthma. The CDC also has great information that's really dedicated to mold and health. And this includes different facts on molds, mold removal, as well as mold remediation.
Okay.
So, go ahead, Dameka. Yep.
I'm sorry.
Oh, I was going to introduce you again. So.
Okay, so in talking about irritants, so as mentioned earlier, irritants are completely different from allergens. So irritants are things that we cannot test for. So, but they are not safe to be around when someone has asthma. So, as mentioned earlier, we do not want to use cleaning products or fabric cleaners that have a lot of smells, and we know we like to smell good, but they're not 100% safe. Same with perfumes and colognes. And then the secondhand smoke is something that is around us a lot, right? But we pretty much know about the firsthand smoke, and that is when someone is smoking themselves. Secondhand smoke is if I were smoking and you all were around, you would be exposed to that. But then that third hand smoke is the smoke smoke that is caught in your curtains, in your couches, on your clothing, and in your walls, in your cars. And that too can also become an irritant for someone that has asthma and can cause one to have an asthma exacerbation. So it's very important that we minimize exposure to all of these and make sure that if there is a smoker, that if they can reduce prevent themselves from smoking in the home and smoke outside, but also using what's called a smoker's jacket. And that's just the jacket that they will put on over their clothing to reduce the amount of third-hand smoke that they will bring back in when they're done. Next slide, please.
So Dameka and I touched on this a little bit, but one of the things that we find a lot, I think, in our work is a lot of our patients do not own their home, and they are tenants with asthma, and it's sometimes hard to implement some of the changes that we discussed if you're a tenant living with asthma. So because of this, we worked with some other partners, including the Metropolitan Tenants Organization of Chicago and the Chicago Asthma Consortium, to develop a specific environmental checklist for tenants with asthma. You can definitely go to this website, the chicagoasthma.org/tenant-checklist to look at the whole document, because I believe it's at least over 15 pages. But this is a really great resource, which I refer some of my patients to if there are concerns about the home environment. Accompanying this, we also conducted 2 webinars, which goes into a bit more detail again about the environmental checklist, which is focused on the 7 principles of a healthy home. But we also incorporated input from the Sinai Urban Health Institute, as well as the Metropolitan Tenants Organization, as well as Legal Aid Chicago, which gave some information on what to do, again, as a tenant, if, what are the channels that you should try to do in order to help make sure that you're living in a healthy environment. And then there was another video that we also created that that kind of did a virtual home walkthrough, so people know what to look for. Even when you're when you're looking for a new place to live, what are the things you should look for even before you sign that lease? So those are just some great resources that we wanted to share, in particular for tenants living with asthma and concerned about some inhalant allergens exposures. So in conclusion, I think we reviewed all of these things, but first of all, inhalant allergens can cause airway swelling and obstruction. So this is why it's so important to try to reduce one's exposure to these, particularly if you have asthma and are allergic to those allergens. Also, indoor allergens can vary from pests like cockroaches and mice, house dust mites, as well as molds. And then also just thinking about those irritants that Dameka talked about, those are, very important to remember. And those can sometimes be more ubiquitous in the home than, some of these other allergens. Also, there are, outdoor allergens, especially if you're keeping windows open in the home, those can come inside the home. And those, again, can be like molds, but also pollens, trees, grasses, and weeds. So those are, just kind of defining the difference between the indoor and outdoor. And then the outdoor allergens can vary a lot by season as well as geography. So those are just some things to consider. So again, some of the other things that we should be doing, particularly providers, is that all persons with asthma should be asked about exposures to different inhalant allergens, and asking and having this discussion about what's the potential effect on asthma. And really, we spend about 90% of our time indoors. And so it's really important, again, to talk about those indoor allergens and then utilizing allergy testing that could help along with the history to identify what inhaled allergens somebody is allergic to. Also, definitely reducing exposure. As I mentioned, avoidance is, one of the best treatments. It particularly in those that are sensitive to those allergens. So again, we're not necessarily recommending reducing exposure if somebody isn't sensitive to them. And then, as we discussed several times, is that allergen avoidance requires a multifaceted or comprehensive approach. So unfortunately, it's not just one thing. It's often multiple things that need to be done in order to reduce one's exposure and have it result in improvements in asthma symptoms as well as exacerbations. So these are some of the additional resources that they mentioned, the EPR3 or Expert Panel Report 3, but also the from 2020, the focus updates, again, the CDC, and then I also included here, again, the Chicago Asthma Consortium tenant checklist as a resource. Again, we're definitely open to answering any of the questions. So please put questions in the question box, and I know we'll be happy to answer them. Thank you.
Thank you, Dr. Nyenhuis and Dameka. Great information sort of behind the scenes of what people need to do to control their asthma, in addition to making sure they're on the right medication. So lots of great comments in the chat. So let's look at a few of the questions that we have. And the first one is, do you have recommendations for allergy-friendly vacuums? We're not allowed to say any brand names, but maybe you could answer that in a different way to give them a little bit more information.
Yeah. Dameka, do you want to take that, or I can either way?
Sure. So, it's not so, the brand of vacuum cleaner is less important than the actual filter. So you can purchase, so they have filters around the vacuum area. So like when you go to your local department store, the most important thing is to get a HEPA filter to put inside of the vacuum cleaner. So that is the most important.
Thank you. We have another one, and this is a really common question, is people ask, how can they completely get rid of mold indoors?
Yeah, so that can be a difficult question. I guess I can start, and Dameka, if you want to add anything. So I guess if you identify mold, it would be something then I think you would have to potentially, it kind of depends on the extent of the mold. Definitely, if there's a little mold, around the bathtub, that can often be used using cleaning agents. And I'll let Dameka talk about maybe, green cleaning agents. So that doesn't necessarily trigger the asthma, because, bleach is a big trigger of asthma. So often I don't recommend that to be used. As far as if it is more extensive and involves walls or ceilings, then at that point, you would probably want to get a contractor involved in order, because they may need to cut a portion of the wall or ceiling in order to remove that. Now I'm just going to highlight, because again, caring for a lot of patients that are tenants with asthma, painting over it, that does not get rid of it. So, I've heard stories of that, where somebody has identified mold and they've just, somebody comes in and paints over it. So that does not get rid of mold. But, again, as we were saying with everything, it kind of is a multifaceted approach. Dameka, do you want to add to what I've said?
Sure, yes. So in mentioning green cleaning products, so believe it or not, one of the things that can actually assist with the mold, and again, oftentimes if there is an observation of mold, and especially if you yourself or your landlord tried to remove it and it continues to grow back in the same area, then more often than not, we should be contacting a contractor, as Dr. Nyenhuis said, to kind of see where the moisture source is. But you can use vinegar and water. So if it's less aggressive, just, equal parts of vinegar and water. And then if it's more aggressive, you want to use full on vinegar. So that can assist in getting rid of it. But again, I can't stress it enough. If it continues to grow in the same area, then you may want to contact a professional.
Great, thank you. Yes, we need to find the source of what's causing the mold. Great information. We have another question that says, I understand dust mites are not present at high elevations such as the Rocky Mountains. Is this correct?
Yes, so as I mentioned earlier, the dust mites really do love humidity. So in high altitudes, the humidity is much lower. So that is another option in areas with low humidity that typically they'll have much lower levels. I would have to look. I don't know if 100% like there's actually zero, but I think living at a high altitude definitely could potentially again have the lower dust mites, but you may still want to, if you're allergic to dust mites, you still may want to do some of those other management things that we discussed, such as the pillow and mattress covers and encasings.
Thank you. And I can tag team on this a little bit because I do live in the Rocky Mountains and we do have some dust mites here. So it's not that we don't have any. We do have a drier climate, but a lot of it depends on if there's evaporative coolers used in the homes and a lot of people living in homes. We have a local professor that's been doing studies on that. And I've been able to see his little dust mites in his microscope. So that's been pretty fun. So our next question is, sorry.
I said, thank you for adding that. That's really appreciated and helpful.
Yes.
Really
yes. We have great skiing out here if anyone ever wants to come out. Another question we had, someone says, I have patients that are frequent marijuana users. So how can we advise them to an alternative if they are smoking for recreational use to feel high? Since we know that smoking is an irritant and smoking cessation is not working for them. So is there any way to help people like that?
Dameka, do you have anything to add for that?
So this is something that we see in our patient population, and it is a bit tricky, especially if the person that is the marijuana user is the person with the allergy and or asthma. So, and of course, our first course of action is to offer assistance to help them quit. But if there isn't, then we ask them if they can at least reduce the amount of times that they are actually smoking. So like if they smoke, maybe 3 times a day, maybe we can, push it down to 2. So it's all in a matter of kind of like meeting the patient where they are at the moment and just kind of working with them without making them feel too overwhelmed, because I'm sure that, they get it all the time from everywhere, right? And so by us just coming in and trying to assist where we can, we don't want to push too much. But, I see that, in my years of experience, that taking little steps can be a great improvement over time. So that's what I would recommend.
Love that. Love that. That's an easy way to sort of ease them down a little bit instead of just saying, you have to quit right now. So meet them where they are. Yeah, great information. We had someone that said, I have heard that keeping windows closed is the best thing that you can do. If either of you want to address that.
Yeah, so again, I think it kind of depends on, what you're allergic to. So again, if, you were to do allergy testing and that person had no outdoor allergens, then, again, we wouldn't, there's no evidence right now to show that keeping your windows, closed would be effective. Now, we talked a little bit about the indoor irritants, but there are outdoor irritants too, like we briefly talked about, like pollution, ozone, and such. So I think it would be, of note to make sure that people know what's going on, what their air quality is like. So if the air quality outside is worse than inside, then yes, you wouldn't want to be opening your windows. But again, in some homes where, some of in my experience, sometimes the indoor air quality is poorer than the outdoor air quality. So it just really kind of depends on your environment. You can use like the air quality index, or it's called AQI. And, I see it on my phone, on, my like Google speaker and stuff like that. So it's, so that can be a part of, when you're checking the temperature, you're also checking the air quality, and that can give you some input on to see, okay, is this maybe an okay day for me to open the windows? And again, also in addition to the air quality, looking at pollen counts. So if, again, you are allergic to trees or other grass pollens and such, and those levels are high, I would keep the windows closed. So, so those are just some things to think about.
Okay, thank you. We have another question. Someone asked, do we need to wash the mattress pad cover or just the sheets?
Dameka, I'll let you take that one.
Okay, can you repeat the question again? I'm sorry.
Yes, and they're just asking, when you talked about washing bedding, they want to know if they just need to wash your sheets or if they also need to wash the mattress pad cover.
So yeah, you can use like so one of the things that I learned in my training is that you can use like a steam cleaner to kind of like when you're washing your bedding, if you want to take that to your actual mattress, and then allow that to like completely dry before you put the sheet and then the mattress cover back on. That's one of the things that you can do to clean it.
Yeah.
Okay.
And you could also definitely, for the mattress cover itself, I probably would recommend doing it once a month. You might not have to do it as frequent as you do the sheets.
Okay, thank you. Someone else was asking about your comment about not having a wet towel in the kitchen and just wondering a little bit
Oh,
more
yes.
about that.
So pests, they love anything that is a water source. So believe it or not, they will like suck the water out of that wet towel. So we don't want to give them access to anything, so food or water. So you want to make sure that that towel is not kept around, where, especially if you notice like maybe droppings, or you notice like this is where the pests frequent. You don't want to keep anything that's wet around.
Exactly. That's what I always tell people. Take away their food and water source. So yes, thank you for that. So another question is, someone is asking, how can we eradicate dust in the household? And that's a never ending problem. As soon as used to dust, it's right back again. But go ahead and answer that question, whoever wants to.
So believe it or not, we do not recommend like dusters. So like Swiffers and things like that, because what they do is just sweep the dust from one area to another. The thing that you want to do is what's called wet dusting. So that's to get like like an old towel that you don't use often, and you want to clean that surface with moisture more so than dry dusting with the duster.
Agreed. Yes, I grew up in the age of the feather dusters, and those are a big no-no now. So thank you for talking about that. Sounds like, I'm not sure if we have a clinician listening today. They asked if there are 4 or 5 questions the healthcare provider can ask about aspects of the home for someone that has asthma or respiratory issues, to know if they need to be referred to a housing assistance program.
Okay, so just I guess maybe what I would recommend is, as I introduced earlier, is these in our tenants environmental checklist, there's the 7 principles of a healthy home. And that can include like keeping things dry, keeping things clean, there's multiple things on that. So, I mean, I think kind of following those primary things as far as, looking at the major things in the home, that can help one better understand, what are the potential triggers. We talked about, again, pets and pests and dust and mold. So, I mean, those are kind of some of the things, but again, I would definitely think like looking at the kitchen and bathroom are often the most, because they have water sources there. Those are two big areas to consider, to make sure you don't have any leaks or cracks, or that where pests could come in. Also in the bathroom, looking for any sources of mold. So you want to make sure that your fan is working properly. So again, you're not having water condensation presenting. And I think that those are I guess the other, and then the last thing would be, particularly in the bedroom, looking at, if is there carpeting in the bedroom. Again, if you're using the dust mite encasings on the pillows and mattress. I don't know, Dameka, do you have anything else to add?
No, I think you were spot on.
Okay. Do you have a few more minutes? We've got a few more questions,
Yeah.
or do you need to get back to patients? Okay. So
I
we
have-
have a couple here, and I will just combine these because they're talking about the RASP test, the allergen blood testing. And they said sometimes it's not accurate, and also what if it's negative and allergy symptoms still persist? What's the next step?
Yeah, so the allergen blood test is a very good test, and can be helpful, but I would say allergy skin testing is a bit more sensitive, so it's a little bit better of a test. So often, if for some reason I did the blood test and it was negative, but somebody still gave me a pretty strong history of exposures to, let's say, cats or dogs, then I will often do the allergy skin test. And there's kind of two types of allergy skin tests. There's the allergy prick test, which often we use a device that is placed on the skin, and it's kind of almost like a hard bristle brush that's put on the skin, and those have allergens on them, and then we'll see. And if that's negative, and again, we still have a concern, then there is something called intradermal allergy test, where there's needles that go right underneath the skin, and a small amount of those allergens are injected underneath the skin. So I guess I would say, if the blood test was negative, I would definitely, seek specialty care from an allergist or somebody who does allergy skin testing to kind of provide that more definitive answer.
Okay, thank you. Someone else is asking, and this is a really tricky question. If there's someone that has a rental and the landlord isn't willing or able to fix any issues with mold or pests, any help that you can provide for that question?
Yeah, sure.
Yeah. Go ahead, Dameka.
So, as mentioned earlier, for renters, there is, a few resources. So, MTO, the Metropolitan Tenants Organization, is one that we over at U Chicago refer our patients to. And so they can provide assistance all the way down to how to speak to your landlord about these more indoor issues. And they will also have some residents communicate with their landlord through an app. It's called MTO Squared Away, where their communication with their landlord, even though it's via text message, will be sent into a cloud, and they can see the landlord's response and assist you also in how to come up with ways to force them to kind of fix any issues that you may have.
Yeah, and I'll just add to that, again, this is a really great resource and was developed with the Metropolitan Tenants Organization about, what to do, and it gives some advice on what to do if you're having issues. But I know throughout the document, as we were doing this, is, the Metropolitan Tenants Organization just said, document, document, document. So, you want to definitely document the first time you reached out to the landlord and what their response was, the second time, the multiple times, because that will provide a record of what you have done and what they have or haven't done. So again, this isn't to necessarily, create a hostile, relationship with the landlord. Definitely we want people to work with their landlord to come up with a good solution, but in some situations it can escalate if things aren't being done, and may need to take legal action. And again, in this webinar that we did, we actually included Legal Aid Chicago, which where they discuss a little bit what are some of the legal actions that may need to be undertaken. Again, this is very specific to Chicago, but hopefully there are similar opportunities in other locations.
Thank you. I know it can be a little bit touchy and when it comes to dealing with landlords or other maintenance companies. So, and this will be our last question. And it says, can you use something else besides a bath mat in the tub since they are a source for mold?
Dameka, do you want to take that one, or?
Yeah, sure. Can you repeat that? I was trying to come off mute to ask.
I do that all the time. We've only been doing Zoom for 3 years, right? During the pandemic, and we still
struggle with the mute button.
We all do. Yes, we're in good company. So they were asking if there's another option for a bath mat, since a bath mat can be a source for mold. So is there something else that they could use in their tub?
Honestly, there is nothing that I can think of. This is something that I get all the time. And so, well, one of the things that I would recommend, specifically like when coming out of the tub, you can place a towel down and just remove it to throw it in the dryer to dry once you come out of the tub. But that's all that I can think of. Dr. Nyenhuis?
Yeah. The only other thing I could say is that instead of using the bath mat, sometimes there are some, gripping strips to put into the tub. So if that's the concern, which wouldn't, lead to the mold, but also, when you're, I guess another option would be, if you're using something in the tub, just making sure that you're, cleaning that, somewhat frequently. And you, again, like Dameka said, you could definitely use that 1-to-1, 1 part water, 1 part vinegar, put that in a spray bottle and have that like by the shower or bathtub to spray that. So that's another option to help prevent the accumulation of mold there. But also, like Dameka said, for the bath mats that go like outside of the shower or bath, definitely you can, making sure that those are hung up to dry or putting them in the dryer, so those don't accumulate mold. And those often can be, put in the washing machine. So when you're washing your sheets once a week, you can also, wash that.
So lots of prevention ahead of time to try to prevent some of these things from happening. Yes.
Lots of prevention. But, as we said earlier, some of these things can be major triggers for exacerbation. So again, definitely talking to your doctor about your, medications, but also really thinking about what can be done in the home could have a large impact also on, your asthma control.
Thank you. And if you can go ahead and just advance the slide one side. We will have a survey after this is over. If you guys have ideas for a webinar, want to provide feedback. Oftentimes when I go through the surveys at the end of the day, a lot of people are suggesting topics for webinars, and we actually have most of these webinars already on our website. If you go to allergyasthmanetwork.org, we've been giving webinars for long enough that we've covered just about all the topics, and you can search on there if there's a different topic that you would like. And if you can go forward one more slide. Next month, we will have 2 webinars, and those are going to be back to back, and that's just how scheduling works sometimes. So long COVID, lasting lung problems. And we're lucky enough to have two speakers from the NIH that will be providing some information about us, some research and things that are going on. And then on the 14th, we'll be knowing the difference asthma or COPD. That particular webinar will be credentialed. So thank you, Dr. Nyenhuis and Dameka, for all your information. I know it's really complex and there's more information on your Chicago Asthma Consortium because there can be a lot of things to look out for when you're looking at the environment and trying to make a healthy home. So thank you again for joining us. This is Andrea Jensen for the staff at Allergy and Asthma Network. Join us as we work every day to breathe better together. Thank you once again for joining us.
Thank you.